behavior analyst, so I'm here to talk to you about preventing and de-escalating challenging behaviors. She kind of already went through this part, so if you have any questions, write them down. And then we'll do questions at the end. I just would like to get an idea, just so when I'm giving examples throughout the presentation, thinking about the child that you care for, your child, how many of you have a child who is 0 to 3 years old? You can just raise your hand. Okay, thank you. About 3 to 6? Okay. 6 to 12? Okay. And then older than 12? Great, thank you so much. That gives me a good idea about how we can talk about behaviors moving forward. So what I'm going to talk to you today, so we are definitely going to get into the meat of it, how are we going to manage these behaviors, but there's some foundational knowledge that's really important that I think that once you learn these foundational tools about behavior and what triggers them and how you react to them, then we can start to think about what kind of strategies we're going to use. So the first thing we're going to talk about is what exactly is behavior? What are we talking about when we're thinking about behavior? And then second, we're going to go through the ABCs of behavior. So I'll walk you through that acronym and what that means. And then we're going to learn about functions of behavior, and that's the why. Why is this behavior happening? And behavior is not as easy as if a tantrum happens, you do this. We really look at why. Why is the tantrum happening? And depending on why that behavior is happening, we might alter how we're going to react to that behavior. So we're going to learn about the why behind the behavior, and then we'll get into things we can do to prevent behavior, and then how to reinforce positive behaviors, and then lastly, consequence strategies, so how we're going to react when a challenging behavior occurs. And if you notice, the consequence strategies, so how we're going to react to behavior, that's just one small component. I say to ABA therapists all the time that up to 80% of our intervention protocols are preventative, and they're teaching and they're reinforcement strategies. And then the consequence strategies are how we're going to react when they have a behavior. But if you take nothing else away from the presentation, it's that the teaching strategies, the reinforcement strategies, and the social praise and all of those positives that are going to prevent the behavior are going to also result in a decrease. Because when we teach our children what they should do, that's often going to result in a decrease in what they shouldn't do. So, what is behavior? So when I'm thinking about behavior as a behavior analyst, I'm looking at what is happening. So that's the tantrum. Maybe that's running away. Maybe that's dropping to the floor in the middle of the grocery store. Those kinds of things we can see and things that are measurable. So the behavior, the emotions that your children are having, that's going to describe how they're feeling when they engage in behavior, right? So sometimes, for instance, difficulty with transitions might be a result of anxiety, right? So your child is feeling anxious about trying something new or about moving on to something they don't want to do. So they're feeling anxious, but then the behavior that they're showing is maybe they're dropping to the floor, or maybe they're refusing to transition. So I really want to stress that today is an introductory course. I'm definitely going to give you some foundational tools. You're going to walk away with practical and general tips, but behavior is very complex. As we know, oftentimes it can't just be condensed into just one function. Sometimes behaviors might have multiple reasons why they're happening. So today's presentation is an introductory course. You're going to walk away with general tips, but I do want to stress that behavior is a lot more complex than just the 45 minutes that we have today. And then that kind of goes in line with, if you have any questions, I can answer specific questions after the presentation. I can stick around, but as far as the Q&A, if you can please just keep the questions more general, because I'm sure everybody has specific situations in their mind that they're thinking of when they're here today. So just keep those questions general would be great. And like I said before, so we're going to talk about how to react to challenging behavior. That's the bulk of our talk today. But like I said, I cannot stress enough, teaching your children positive behaviors to replace those challenging behaviors is just as important. And teaching occurs when your child is regulated, when they're calm, when they're happy. So these are the kinds of things that you're going to teach when your child is not engaging in tantrums or she's not running away. Taking those times when your child is happy, is regulated, and teaching them, how to try something new, maybe a new food, things like that. So we want to encourage flexibility, encourage your kids to try new things, doing all of that stuff when your child is happy. And then, like I said, a lot of behavior is a result of your child not having the tools that they need to express themselves, or not having the tools that they need to cope with their behavior. So they might not know how to show their frustration appropriately. They might not know how to show their anxiety appropriately. So then they engage in challenging behavior. So teaching them how they can show those emotions and still let them know that those emotions are okay to have, but there's a way to do it appropriately. We all get sad, we all get frustrated, we all cry. So letting your child know that those things are okay, but it's not okay to throw toys at your sister, or it's not okay to drop to the floor in the middle of the store. Okay, so we're going to identify first the ABCs of behavior. So for every challenging behavior your child is going to have, there's going to be an antecedent, which means the trigger, or what's going to happen right before the behavior, what provoked the behavior in the first place. And then the behavior, like we talked about, is what you can see your child doing. So that's the tantrum, that's the running away, hitting, that kind of thing. And then the consequence is how you react to the behavior. So the consequence is going to determine whether or not that behavior happens again. So if you, what happens a lot of the time with behaviors that maintain is that we inadvertently reinforce the challenging behavior. And even ABA therapists who are trained, and they've been doing this for years, they still sometimes can inadvertently reinforce behavior. So that's why when we move forward to the function and we start talking about the why behind the behavior, then we can learn how to react to the behavior appropriately. So just to give you a couple examples of this. So we have Lily, who has eaten most of her dinner, and she didn't eat her broccoli, and Dad says, Lily, you have to eat your broccoli. And Lily throws a tantrum, and she throws her plate, and she throws her broccoli on the floor, and she yells, no, 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 I don't want my broccoli. And then Dad says, okay, Lily, you're all done. He makes Lily clean up the broccoli. He has Lily take the plate to the sink. He sends her to her room. He says, you're all done for the night. So that might seem like, okay, that's an appropriate consequence. Yes, she had to clean up her broccoli. She had to clean up her plate. She's getting sent to her room. But what happened was, the outcome, Lily didn't have to eat her broccoli. So the antecedent, what provoked it, was that Lily did not want to eat her broccoli. And the consequence was, Lily did not have to eat her broccoli. So recognizing those kinds of consequences is pretty important. So sometimes we think that we're providing an appropriate consequence, but it might actually be inadvertently reinforcing a behavior. So another example that I have is for an older child. So Johnny got a D on his test, and Mom says, you cannot go to the movies. And Johnny yells, that's not fair. He begins to cry. This is a new Avengers movie. Everybody's seen it, and he hasn't. And he's begging, and then Mom finally says, okay, fine, but make sure you get a B next time. And that's the okay, fine, is what I call it with parents. It's like, okay, fine. So the outcome, Johnny's able to go to the movies. So what's gonna happen is, next time, Johnny's probably gonna whine and cry again because that was effective the first time. So those are the kinds of things we're looking at when we're looking at what is triggering the behavior and what is the consequence. And the consequence is what's gonna maintain the behavior. So by knowing that, by recognizing what those potential triggers are, what things that are likely to trigger those behaviors with your kiddos, that's when we can start to develop preventative strategies. So like I said today, our our presentation is kind of general, it's kind of an introductory course, but what you can do, you can take that home and you can think, oh, okay, Johnny usually has issues when we have to go to swim practice. What can I do to arrange the environment to help set Johnny up for success before we transition to swim practice? So it's not just all of a sudden, Johnny, get your shoes on, it's time to go. Maybe we can set up preventative strategies around that. So identifying those triggers for behavior are important in recognizing and developing those preventative interventions that we're gonna talk about in a little bit. And then same thing, being cognizant of the reaction to your child's behavior is gonna aid in effective intervention. So that just means making sure that how you respond and how you react to your child's behavior isn't going to inadvertently reinforce or inadvertently maintain that challenging behavior. And it's also important to recognize, in theory, this is great, right? We would love to say no 100% of the time. We would love to stay strong, but you're parents and you have multiple kids and maybe you're cooking dinner and one child is over here and one child is over there. So we understand that 100% of the time is definitely not realistic, right? But doing the best that you can to react to behaviors appropriately. So moving into talking about the why behind the behavior. So there are 4 main reasons why behaviors occur, and it seems very simplistic, but it's actually true. So everything we do can be grouped into these 4 reasons why behaviors occur. And the acronym is SEAT, that's what helps me remember it. So the first one is sensory. Sensory behaviors are behaviors that what we say are not socially mediated. So those behaviors are gonna occur if your child was left alone in a room without anybody around, they would be engaging in these behaviors. So those kinds of behaviors are often like hand flapping or rocking back and forth, lining up cars, that kind of thing. Those are sensory related behaviors. Escape maintained behaviors, that is avoidance. So your child does not wanna do something that they were asked to do. Attention-based behaviors are behaviors that occur to get attention. And we'll talk about this a little bit more when we get to the attention function, but a lot of times with attention-seeking behaviors, it's really hard to ignore them. So that's how they can escalate and then they get worse, right? And we'll talk about that a little bit later. And then lastly, tangible, so to gain access to something. So those are behaviors that occur in order to get something that we want. I just realized that I see you all taking pictures. There's definitely a sign-up sheet that we can pass around, and if you write your email down, we'll email you the presentation slides, so you don't have to worry about taking pictures of every slide because we can send you the PDF. Okay, so like I said, sensory behaviors. So sensory behaviors, every family is different, every interventionist is different. So my general rule of thumb is I am not going to target sensory behavior for decrease unless it is impeding the child's learning. So I don't necessarily think that hand flapping is inherently something we should decrease, but if it's to the extent where the child is not able to learn because that's all they're doing, then we might intervene. But that's just my perspective, so another interventionist might say different, and you're the parent, so you have the ultimate say. So you are the ones who ultimately decide whether these behaviors are gonna be targeted for decrease or not. So this is going to be things like I said, lining up cars, hand flapping, rocking, sometimes, and another sensory related behavior sometimes is what we call vocal scripting. So children who might replay scripts in their head, or maybe they're vocalizing something that's like, it's not functional, it's kind of a repetitive speech. And from my experience, that can be, the vocal scripting can be a little bit tricky because that can definitely start to impede on learning. And then, like I said, getting out of something. So these are avoidance behaviors. And oftentimes, if your child has trouble with transitions, this is the function. It's because they do not want to do whatever it is next. They don't want to move to the next thing. oftentimes transitioning from a preferred activity to a non-preferred activity can be really tricky, right? And then that kind of gets into, we won't get too much into it today, but kind of both, right? Escape and tangible, where they have to give up something that they want and they have to do something that they don't want. And then also, if your child displays like anxiety a lot, so a lot of times like those anxious behaviors, those are gonna be escape maintain behaviors. They're hesitant to do something new, or they're hesitant to try something because they're worried. Those are gonna be escape maintain behaviors. And then attention. A lot of times, young children, especially children with autism, they might engage in attention-seeking behavior because they think the reaction that they're getting from their brother or sister, they think the reaction that they're getting from their parent is funny, without understanding the true social implication of what's actually happening, right? So we have, at 2, 2-year-olds have not developed a sense of empathy yet. They're developing that. So they might not understand that I bit this child, and now this child is hurt. They just think it's funny, or they think it's silly, or they think that your frustration is funny without actually truly understanding that I hurt somebody. And then that's, again, gonna play back into, like we said earlier, teaching when your child is calm. Teaching that those behaviors are not okay, not when your child bites, but when your child is playing and they're happy, and you teaching them, do you see how calm you're playing with your baby right now? Pointing out those positives when they're happening. I said it's often the cause of instigating because with older kiddos, I know with me and my sister when we were really little, when you're teasing your brother or sister, you're I call it instigating your brother or sister, oftentimes that's an attention maintained behavior. They're feeding on that negative attention that they're getting from their siblings. And then tangible. This one's pretty straightforward, right? We either have to transition away from something that we have, maybe transitioning away from the iPad. You're in the grocery store and your child wants a chocolate bar, and you say, no, you're not getting a chocolate bar, and then the world ends because they didn't get their chocolate bar, right? Those behaviors are tangible, so those are access maintained. Sometimes we'll call it access as well. So by recognizing why these behaviors are occurring and recognizing what's provoking them and recognizing how we're reacting to them, then now we can start to get into what are some strategies that we can use to prevent the behavior, and then what should we do when the behavior happens. So I've broken down the strategies by function. And I completely understand that, like we said before, behaviors are complex. So sometimes the function might not be clear, and sometimes maybe there are a lot of things happening throughout the week where, it's Friday and Johnny's been in school all week long and he didn't take a nap the last 3 days, and you're just not sure. He's just crying because he's, you don't know why. So we definitely understand that, but trying to understand what was the last thing that happened before Johnny started crying, so we can start to target it that way. Okay, so preventative and reinforcement strategies for sensory-related behaviors. So what a good recommendation that one of our occupational therapists gave to me as I was developing this is heavy work. So some of our kiddos seek input. They seek sensory input. They kind of have a higher threshold than what neurotypical kiddos might have. So some kiddos, they're just go, go, go until bedtime, right? So for those kiddos who just kind of need that input, give them heavy work. So give them chores to do, have them wash dishes, have them take out the trash, have them vacuum, obviously depending on age. So giving your child those chores and that heavy work to do can help with some of that sensory input, where later on they might not have behaviors that are related to the need for sensory input. And then also giving your child functional replacements that kind of give them that same feeling. So this particular kiddo, he really loves visual input. So we know that when we're doing instructional time, that visual input, he's gonna seek that out. So if we give that to him before we start our instructional time, that'll really help him with the focus because he's already had that visual input that he seeks so much. So preventative and reinforcement strategies for escape maintained behavior. So things that your kid just does not want to do. With our little kiddos especially, giving them choices when there are not any choices to be given. So giving your child a sense of control in their environment, even if it's as little as, do you want to put on your left shoe or your right shoe first? Do you want to get ready in 2 minutes or 4 minutes? Giving your child as many choices as you can will help them feel in control of their environment, and then they'll be a little bit more likely to respond to you when they have to have those transitions, or when they have to do something that they don't want to do. And then another expectation for, or another preventative strategy for escape maintained behavior is outlining expectations clearly. So if you let them know before whatever it is going to happen, what needs to happen, then there's no wiggle room for bargaining. Sometimes the older kiddos, they're really good at bargaining, right? They're really good at, well, if I do it this time, but if you're outlining the expectation before the behavior even happens, before you're even doing the transition or whatever it is that your child typically doesn't want to do, then you're setting yourself up for how to react appropriately for the behavior if it happens. So an example of this might be, okay, so do you want 4 minutes or 5 minutes? Okay, you want 5 minutes. In 5 minutes, you're going to put your shoes on, you're going to get your coat, and you're going to meet me at the door. It's time to leave. And then when they start to have a behavior, then at that point, this is what I told you to do, this is what we're going to do. Phrasing is really important. It might seem insignificant, but if it's not something that you're willing and able to follow through with, don't phrase it as a demand, phrase it as a choice. And what that means is sometimes, like I said, y'all are parents, you've got multiple kids, you've got lots going on in your lives. You're just sometimes not able to follow through, and that's okay. But don't say, but something to consider when phrasing is, instead of saying, it's time to do this, do you want to do it? Because if you're not prepared to follow through, you can make it a choice, and then that keeps you in control of what's happening. And then if you're giving an instruction, or you're telling your kid that they have, it's time to do this, or we need to do that, then you're prepared to follow through when you're phrasing it as an instruction. And that's something that seems really small, but I can't stress the significance of it. And then also having a preferred activity line up. So we call that first then contingencies. So if you know that Johnny doesn't necessarily love to go to the grocery store, but you have to go, then maybe you can have something fun lined up for after the grocery store. And that's not bribery, that's reinforcing Johnny for his positive behavior. So Johnny, if you do well at the grocery store, maybe we can get an ice cream cone on the way back, or maybe we can do something that you want to do. And then again, with the first thens, be prepared to follow through with that. So if you're going to offer a reinforcer, if you're going to offer Johnny ice cream after the grocery, be prepared to give him ice cream after the grocery if he does a good job. So preventative and reinforcement strategies for attention-seeking behavior. So goes back to what I said before, teaching when your child is calm, teaching your child how to ask for attention appropriately. Tapping you on the shoulder and saying, hey dad, hey mom, hey, look what I did. And really reinforcing when your child does those things. So when you see your child ask for attention appropriately, throw a party. Those kinds of things need to be reinforced. Your child needs to know that you're recognizing what they did was right, and then they're going to be more likely to do that in the future. And then again, like I said, throw a party for appropriate behaviors. For the little guys, countdowns until when they have to give up the item. So in therapy, I don't like to get too dependent on timers, but as parents, if a lot of times that visual input for the child is going to be really helpful if you set a timer for them, let them know, again, giving them the choice of what time, and setting the timer, and then being ready when that timer goes off to transition, and knowing your child. So the amount of time that you're going to set the timer for is going to be up to you as the parent. You all know your child. And then for little guys, a visual schedule, sometimes if your child is already receiving services of some kind, they might be using one. But this is gonna help, the visual schedule is gonna help with transitions, and it's gonna help your child see what's happening throughout their day. So they know, okay, I need to do this, this, and this in order to get my Kindle or my iPad or whatever it might be, my toys. Okay, so we've talked about the ABCs of behavior, we've talked about the functions of behavior, preventative and reinforcement strategies. So now we'll talk about consequences. So how do we react once the behavior is actually happening? So sensory are pretty straightforward, just giving your child something else that they can do that's gonna have that same feeling. Sometimes it's really hard to get a child engaged when they're engaging in a sensory behavior. In therapy, sometimes we'll do what we call behavior momentum, and what that just means is having your child do simple tasks that they already know how to do to kind of bring them to focus, bring them to attention, or attend to you. That will help for them to gain focus, and then they can listen to what you're saying. So an example of that might be, Susie, can I have your eyes? Give me a high five. Good job. Clap your hands. Great. Okay. Now let's do this. So getting them focused before you're giving an instruction will help with sensory-related behaviors. And then again, if you have a child where they engage in a lot of sensory-related behavior and you're just not really sure what to do, like what kind of replacement behavior should I do, come see me afterwards and we can talk about that. I can give you a little bit more specific information regarding that. So follow through with escape maintained behaviors is very, very important. So if you told Johnny that he's gonna have to do something, making sure that Johnny does it. And again, I understand this is easier said than done, and it's not gonna happen 100% of the time, but trying your hardest to follow through. And then if follow through is not possible, if we call it the point of no return, if Johnny is just you cannot get him to do whatever it is you wanted him to do, making sure that you're gaining compliance of some kind, making sure that you're maintaining control of the environment, and that you're, even if it's as simple as Johnny using his words to say, I need a break, or I don't want to, or please no, just as long as that behavior did not result in him getting out of what he needed to do. And then that goes back to, if you're not ready to follow through, make it a choice. And then making sure that if it's something that your child really doesn't like to do, let's say it's brushing teeth and you have to brush your teeth every night, but they just do not want to brush their teeth, they don't like to do it, and it's something that has to be done every night. Making a routine around it, making sure it's the same time every night, making sure that you're making a routine so where every night it's going to be pretty predictable that we're going to do this, and we're going to brush teeth, and then after we brush teeth, then we can have something that we want, and have a reinforcer lined up. A lot of times bedtime is a hard one because kiddos do not want to go to bed, but they have to go to bed. So that's one where you kind of have to follow through. So just, again, like I said, I can't stress enough, those preventative teaching reinforcement strategies, have a routine set, and then that will help with some of those behaviors. So consequence strategies for attention seeking. Planned ignoring is ideal, right? But we know that we can't always ignore everything, and that's how attention seeking behavior gets escalated. And a lot of times, negative attention, or not a lot of times, all of the time, negative attention is still attention. So sometimes it might not seem like it's appropriate to ignore a behavior. It's like, well, he just hit his brother. How do we ignore that? But what we can do is teach him, again, when he's calm and after the behaviors occurred. So an example of this might be, you have brother and sister hits brother and is looking at mom, just looking you right in the eyes when she does it, right? So that tells us that She knows what she's doing is wrong. So that might not be the most appropriate time to say, no, stop, don't hit your brother. Because she knows she's not supposed to do that. She's looking at you and she's doing it, right? So what you can do in that situation is call all of the attention to brother, right? Oh my goodness, are you okay? You know, I saw that she hit you, is that okay? Putting that attention on the sibling is gonna, you're gonna model how to react to those kind of behaviors, and you're taking the attention off of the child who hit. And then, after the behaviors occur, after the child is calm, depending on age, maybe 5-6 minutes later, then you can go back to your child and talk to them about it. Was that okay? Did you think that was a great choice? What kind of choice could we have made differently? How can we do this a little bit differently next time? So sometimes talking about those behaviors are best done after it occurs, not right when it's happening. A lot of times our immediate reaction, and even with therapists who are trained, our immediate reaction is to give negative attention. It just is. Stop, don't do that. What are you doing? But trying to yourself be cognizant of that. And again, plan ignoring if you think it's an attention-seeking behavior. And then access. So access to tangibles. Again, this is very, like I said, very similar to the escape behaviors. Holding strong when you say no. Being strong about it. You can do it. I know it's easier said than done. But holding strong, that's gonna, again, it might get worse before it gets better. But holding strong is definitely the way to go. With that one. So another thing that you can do is giving them a time estimate for the next time that they might be allowed access. So an example of this might be, you have to leave your play date right now, but you'll be able to play with so-and-so on Tuesday. Or you'll be able to play with so-and-so, on whatever day that your next play date is. So letting them know the next time they're gonna be able to access whatever preferred item that they have, that can be helpful. And then if possible, you can give your child something else that they can have. Like you threw the truck, so you're all done with the truck now, but you can maybe play with this tree. So things like that, giving them something else that they can have that's not necessarily as reinforcing, but has a similar effect for them. Okay, so I wanted to put together all of this information that you were given today. So I have 2 small video clips, and so what I want to do with the video clips is identify what triggered the behavior, the reaction to the behavior, and what the probable function, why was this behavior happening. So we're gonna play those.
She took him straight to the naughty spot.
I'm getting to you, little girl. I'm getting to you.
Whilst Mop's feeding baby. Andrew wanted his chocolate milk warmed up and
Just while she's making sure that the video can work, I'll walk around, I'll collect any index cards that you've already filled out. Or if you need an index card, I have a few more and pens as well. These are for questions. Any questions? If you want to write them down, if you want to ask them, you can raise your hand as well. But if you prefer for me to ask them, I'd be happy to do that for you.
It hit her.
I'm good to see you, little guy. I'm good to see you.
Whilst Mum was feeding baby Sean, Andrew wanted his chocolate milk warmed up and he threw a massive tantrum over it.
I can't even understand you crying so much. When you're done crying, you come up and ask me what you want nicely. What do you want, Andrew?
Listen, I don't understand you. Talk to me properly so I can understand you.
Talking. I don't understand you, Andrew. You want your drink warmed up.
So ask me nicely. I'd like my drink warmed up, please,
Say it.
Mummy.
I want my drink warmed up.
No. I want to teach Andrea how to not give in to Andrew's tantrums. What's going on?
Come in, Grace.
Come to the show. He looked very pale. You okay? You seem... Is it the crying? I've never seen him that... in this manner before.
You don't hit me, Andrew. I don't like that.
Andrea started to catch on very quickly, and when he hit her, she took him straight to the naughty spots.
You don't hit people. You sit there and you think about it. It upset me as a parent to see my child become that emotionally upset where he was just almost begging to be picked up and held.
I want you to listen to what I'm saying, because I've been in many houses where parents have thought, oh my God, it feels like it's all gone mayhem. It feels like it's getting worse. The only thing that just got worse was that Andrew just realised that his mum and dad are now in control of the discipline.
You don't hit me. All I want you to do is say, Mommy, can you warm up my chocolate milk? In a nice way.
Don't pick him up, it's not a baby. Don't pick him up, don't pacify me that way. Honestly, you are not...
Okay. So that is, I found that was a really good example because as parents, it's really hard to watch your children cry. It's really hard to watch them have that tantrum. You want to hold them, you want to comfort them. But what she said was absolutely right. They're just creating boundaries, and that's all that they're doing, and it will, I promise, maximize the long-term benefit. It might seem really hard in the moment, but dealing with that tantrum like that when he's 3 is much easier than when he's still doing that at 8, right? So does anybody want to identify what was the trigger? What was the antecedent to that behavior? He wanted his chocolate milk, right? So what do you think the function was? Tangible, right? He wanted the milk. He wanted his milk warmed up. And there could have been, like we said, there could have been a little bit of attention component in there, right? Because maybe his brother was the one getting attention and he wanted the attention. So that's definitely a good observation. And then the consequence was she had him ask nicely. That's all she wanted him to do, was ask nicely. And if you notice, we're not going to get too much into it today, but it will get worse before it gets better. That is scientifically proven over and over and over. So if you feel like, oh my gosh, this is getting so bad, it's probably working if you're doing what you're supposed to be doing, reacting to the behavior. So if you take home some of these points and you're like, I'm gonna do it, I'm gonna hold strong, and then all of a sudden the behaviors get worse and you're like, what is this person doing? She doesn't know what she's talking about. I promise it will get worse before it gets better. And we're gonna watch one more.
Did everyone get a chance to sign the list if you want to receive the slides afterwards? No. We'll also have it at the back of the room on your way out if you want to sign on the way out. You can just keep passing it back.
Okay, so that example wasn't as cut and dry, so I will walk you through that one. So he's cleaning up his toys. He cleaned up all of his toys except the last one, and then he looks right at mommy and daddy who's recording, and then he throws his toys. So maybe he's feeling like, I didn't get attention. Nobody praised me. I'm doing what I'm supposed to be doing, and I'm not getting any attention for it. So then that'll go back to our preventative strategies. Reinforce, socially praise your child when they're cleaning up and doing what they're supposed to be doing. Even if you think, well, it's expected, still let them know that you see it. And then most likely that was an attention-seeking behavior. So if you notice, he's looking right at the camera, right where mommy and daddy are recording, and then he's doing more, right? He realizes that they're ignoring him, so then he makes it bigger. Then he throws his body. Then he kind of throws the bag of toys. But if you notice, he kind of realized, oh, I'm not really getting any attention for it. And then he kind of stopped and walked away. So that's one of those instances where you, as a parent, want to just jump in and say, no, don't throw your toys, you need to clean them up. But in that situation, maybe ignoring was the best thing to do because he just realized that he wasn't getting attention, and then he moved on. Okay, so that's about all I have for you. I am definitely ready to answer any questions.
Okay, this is one that I've wondered about as well. How do you handle spectators or other people who are around who can't believe you're ignoring a bad behavior? So if you're ignoring the behavior but you're in public, what do you do?
That is a hard one, definitely. I can definitely understand, you know, you know, it might be embarrassing for you as a parent. If you feel like people are watching and you really feel like you need to, you know, say something to them to let them know, oh, I'm purposely ignoring my child, or I've got a handle on that, then let them know that. But my personal thing is, well, we're teaching. This is a teaching moment, and just, again, remembering that long-term benefit is going to be much better, right, than just that short-term reaction. So just knowing that as a parent, understanding that, yes, this might look bad, but I know that what I'm doing is the right thing to do. And then again, like if you feel like, wow, this person's staring at me, let them know, I've been trained to do this, or I know what I'm doing, or, I'm purposefully ignoring this. If you feel the need to let them know.
Okay, what is visual input, and can you provide an example?
Yeah, so visual input, a lot of times it will affect our children with sensory processing differences and autism spectrum disorder. So some behaviors that children will display when they want visual input, again, might be like lining up the cars to look at them. If you have a child who like kind of gets down like at a parallel to look at something a specific way, that's visual input. Other behaviors that I've seen are moving their hands back and forth and looking at that. Essentially, some children, they really like to see things in a certain way. And that's what I meant by visual input.
Right. How do you handle attention-seeking behavior with a nonverbal only child, and what would be the types of consequences you'd be able to apply?
Can you repeat that? Attention-seeking behavior with a nonverbal. Okay, so if your child is nonverbal, I'm sure that they've got to have some sort of communication in some way. So however they're communicating to you, it might not be with words, but maybe with sign or pictures or gestures, reinforcing that. So reinforcing any communication. If your child is nonverbal and they're receiving any kind of services, that would definitely be good to consult with their specific therapist, because again, this is kind of specific because your child is going to have their own specific things that are reinforcing to them and specific ways that they're going to want attention. So whoever wrote this, if you can come see me afterwards, I can get a little bit more information from you. And then I can give you a little bit better feedback.
All right, are there any books that provide strategies consistent with what you teach parents, so other external resources?
Yes, definitely. There is, Dr. Mary Barbera is a really great, she's a doctoral level BCBA, and she's also the mother of a child with autism, and she has really great resources. So she has a book called The Verbal Behavior Approach that was written in a parent-friendly way, and then that's kind of about how to teach your child how to communicate and what they should do, and then as a result, decrease behaviors in that way. But if you come see me, I can give you some of that information. Dr. Mary Barbera. No, she was asking. So again, that's kind of a specific one. If you asked how do you get your 3-year-old to get in bed and stay quiet at bedtime, come see me after. I can talk about specific strategies. So every child is so different. So you know your child best. You know what stories your child likes. You know what your child likes to do at bedtime. You know what activities are winding down for your child, and you know what activities are going to rile your child up. So you as the parent, I promise you all probably have more tools in your toolbox than you realize. So digging down and recognizing what your child needs. Again, you can come see me after, and I can give you specific strategies, but again, that's kind of a specific one. My son cries different and his eyes have a different look when a meltdown occurs. Could he be getting seizures at this time? Yes, I cannot answer that question. That is definitely a very specific thing. I can definitely not identify a seizure. That is not within my scope. But if you come see me afterwards, I do have experience working with children who have seizures. But seizures can be anything from a blank stare to a full-on grand mal. So there's a really big variety of that. I'm sorry, I couldn't answer that a little bit better. Wonderful.
Can you give an example of when you said that phrasing is so important? I believe it was in like the escape behavior section. Can you give an example of a demand versus like a few?
Yes.
Demand versus choice?
Yes, exactly. So that's a great question. So an example of a demand versus a choice might be if you're at dinner and you want, like the example before, he said, Lily, eat your broccoli. That is a demand. You told Lily she needs to eat her broccoli. But if you said, Lily, do you want to eat your broccoli first or your rice first? Then she would be able to choose which one she wanted first. Lily, do you want to eat broccoli or do you want to eat asparagus? Giving her the choice of what she can do. Or even just, Lily, do you want to eat your broccoli? Yes or no? So essentially the choices are almost always going to be yes or no question. It's going to be phrased in the form of a question, and a demand is going to be phrased in the form of a statement. This is something that you need to do. And then again, giving your child control of the environment by choosing when they need to do it, how they need to do it, with who. Do you want to do it with mommy or daddy? So you can give your child a sense of control when they have to complete a task, but letting them know that they have to complete the task.
So, is it inadvisable to I think I've read stuff that says, oh, you can hug your kid who's having a tantrum. At what point do you hug a kid and just offer love?
I have a very child development model. So BCBAs will tell you differently. Depending on the severity of the behavior and how the behavior is occurring, I am not one. Some BCBAs will say just completely ignore the tantrum, depending on why or how it's occurring. It really depends on the function, but in general, I never tell parents to, your child is 3 and they're having a meltdown and it's the end of the world after the behavior, definitely. So the example of Super Nanny, how she said, don't pick up your kid. That part's debatable. You can console your child, but she was right in the sense of you do need to create boundaries. So that kind of depends on the age, the severity of the behavior, and then what the function is, why it's occurring. But in general, I say, give your children love. Anything else? Oh.
Are there any, simple tools or simple approaches that you can use for other caregivers? So whether it's family members who are going to be with the child for a period of time, babysitters, etc. Are there anything that you can do to kind of help guide them in this practice without them being completely?
Yes, so that's a great question, and I think that goes to taking the things that you learned here, so recognizing what your child's regular triggers are, recognizing the things that they have difficulty around, identifying ways that you can prevent and ways that you can structure the environment to help them with those situations, and then letting other caregivers know about that. So he has trouble with, this tends to be a source of anxiety for him, so this is what we do to prevent it. So passing that message along and developing those tools yourself as the parent.
Anything else? Is there any other questions?
Yeah.
I have a question. I wonder if you have any advice whether it's a child that wants to get attainable sensory or whatnot, that his go-to behavior is self-harm, or they want to bite or throw themselves on the floor. Any suggestions on what to do with this little one?
So again, that's going to depend on why the self-harm is happening. A lot of times, so that goes back to, one, you have to keep them safe, right? So you're going to want to block that behavior as much as you can. But a lot of times, what we can do for self-harm behaviors is blocking the behavior when it's occurring, but also minimizing the attention that you're giving it. So then you're teaching the positive way, you're teaching those positive behaviors when the child is calm and happy. So like we talked about, reinforcing positives and teaching the positive while your child is calm, but then when your child is engaging in the self-harm, sometimes less is more with our verbal language. So physically providing the assistance and the help that you need while minimizing the attention definitely can help with that. Another thing is sometimes when kiddos, they get to the point of no return, and you're trying to talk to a child when they're screaming and crying, they're not processing anything at all that you're saying. So trying to teach them at that time, it's just not going to be effective. So sometimes less is more when it comes to the verbal language.
Do you have any advice on replacement behaviors as distraction? Or something to replace distraction?
Anything else? Thank you so much for having me.
Thank you.